On-the-scene video coverage of TCT 2012 is supported by Pradaxa.
There are two trials presented that look at percutaneous closure of a patent foramen ovale. Both trials use the Amplatzer closure device and compared that to medical therapy, be it warfarin or antiplatelet therapy, and looked at outcomes, notably recurrent stroke.
The RESPECT trial was looking at how do we further reduce the risk of having another stroke in fairly young people between the ages of 18 and 60, where we haven't known the cause of the stroke. It's been cryptogenic. Because we want to reduce risk as much as possible. And the point is these people still go on and have another stroke at a rate of 1 to 2% a year. And for someone who's 46, if you extrapolate that over time, that's a significant risk of still having a stroke despite medical therapy.
Although they're relatively infrequent, the results are catastrophic. So if we can do anything to decrease the risk of these paradoxic emboli, I think we should try.
In addition, the most intensive medical therapy, anticoagulation, requires a lifelong exposure to bleeding risk, and with warfarin, continuous need to adjust the medications, control their diet, and other impositions on lifestyle that patients are not happy with.
I can tell you I've had that conversation with literally hundreds of patients in my career, and people are desperate to have something more than what medicines alone can offer.
The results were in the device group versus the medical group. We saw a significant risk reduction in favor of the device group that reached statistical significance in the per protocol and as treated patient population, not the intention to treat, that reached a p-value of 0.08 rather than 0.05.
Now, there was quite a bit of crossover in the arms that, in the patients that actually had events. And so if you look at who actually got the device versus who actually got the medical management, there was actually a substantial benefit, up to 60 to 70% risk reduction in the arm that got closure.
For neurologists, it's a very good and optimistic message from the studies today that we do have an alternative to medical therapy that has evidence of greater benefit than medical therapy.
To me, these results are very favorable. I think individually the trials are small and to moderate in size, but when put together, likely a meta-analysis would show a significant benefit of the closure approach.
So in these highly selected PFO patients followed for out to 8 years, possibly there's a slight, not dramatic, but slight benefit for a device over drug. So those are a lot of ifs, ands, or buts, obviously. I would say none of these studies is a slam dunk for a device. I mean, there's some, in a pure statistical sense, they're all negative studies. The absolute risk reduction, even if we look at RESPECT, is less than 1% per year device versus medical therapy. Of course, they're always reporting the relative benefit, which always looks more dramatic, 40 to 70% relative benefit. But if you look at the absolute benefit of the device versus stroke using the trend, it's less than 1% per year. My interpretation is that there's some hint that there might be a slight benefit of device over a many-year period in highly selected patients compared to medical therapy, which has not been precisely defined either. And so that's how I would put this into context and not overstate in sort of a corporate spin mode the results of the trial.